Stop Section 453. Section 453 is a 9-line rider in the FY 2026 Interior Bill. It blocks EPA label updates, freezes outdated science in place, and gives chemical companies immunity from lawsuits. If it passes, 57,000 pesticide and chemical products will be shielded from accountability. Call your representative and say, "Please remove Section 453. It strips Americans of due process, defunds critical label updates under FIFRA, and protects foreign chemical corporations instead of public health."
Hey everybody, and welcome back to the Beef Initiative YouTube channel. I am your host, Breeauna Sagdal, and I'm very excited to introduce a friend of mine, Dr. Muñoz, who is here to discuss in what we're calling an immunity rider, which is part of a House Appropriations bill on the environment and the interior environment and other related agencies. Basically, it's a big budgetary bill. And Congress is attempting to strip away funding from the EPA that, in my opinion, really makes me question what is the point of the EPA if it can't really act to begin with. Anyways, so joining me today is Dr. Muñoz. Will you please introduce yourself and give us a little background on yourself?
Sure. Thanks for having me today. I am a molecular toxicologist, so I have a PhD in molecular toxicology and carcinogenesis, which means that I spend a lot of time studying how toxins interact at the cellular level and lead to things like cancer and infertility and other diseases. And I have been advocating against the state level versions of these pesticide immunity bills. And now I'm working on this federal rider that's been slipped into the appropriations bill, and that creates a pathway to immunity for chemical manufacturers.
Can you walk us through the state level bills just to start with and explain what Bayer Monsanto has been trying to do at the state level?
Yeah, so at the beginning of the year, they proposed legislation in a number of states that would essentially give their company and their entire industry de facto immunity from lawsuits. So people wouldn't be able to sue if they were harmed by any of these chemicals. And the way that they set it up at the state level was pretty different than what we're seeing at the federal level in terms of the language of the legislation and the way that it operates. And at the state level, what we were seeing is that they were creating language that essentially presumes and assumes that the EPA's approved labels reflect the actual health risks of the product and that they're sufficient to warn. And so once you get an EPA approved label, then you shouldn't be able to sue any of these companies. That's the basis of what they've been saying. But unfortunately, the EPA is not doing a very good job of regulating these products and of, pushing the companies to provide accurate data. And so the data that they submit to the EPA is often falsified or structured in ways that avoids really important toxicological information. And so the EPA approved labels just aren't sufficient to warn. And as a result, if they were to pass one of these bills, they would be making these very inadequate EPA labels the law, and people would still be getting harmed by these products, and then they would have no recourse to take against the companies. And more importantly, there'd be no informed consent. There'd be no mechanism to bring that forward through the courts.
And for anyone who's not aware, I actually have a label around here somewhere. I should have brought it for the camera. But like when it comes to EPA labeling on pesticides, herbicides, rodenticides, it's not like an FDA label that you find on your food where you have like this whole list of ingredients. It'll say like one made ingredient and it might account for like 7%, right? And then the rest of the 93% of the label are labeled other ingredients, and you have absolutely no idea what those are. And you have to almost be like a molecular toxicologist to even understand. I mean, and I'm not I'm not the smartest, right? I'm not the brightest crayon in the crayon box, but I mean, I'm kind of average in terms of IQ and so forth and what have you. And I couldn't figure out what the difference was between paraquat or dicamba. I was like looking up different things and just trying to like get a foothold in this conversation because I was completely unaware of this whole entire situation to start out with, right? And so I was just like looking up on Google, and even Google told me that paraquat had dicamba and in it, which is obviously totally infactual at this point. My point in bringing this up is that when it is the average person, in addition to farmers and ranchers who are buying these products, and the average person is going on to Amazon and looking for weed killer, and there's maybe one ingredient listed, and there's absolutely nothing else listed about what the other 93 or 98% or whatever it might be in that product, what it does, how it could potentially harm your health, when to use it, how much of it to use. I'm sure these exist somewhere, but to me, it reminds me of the vaccine excipient list. Like, you have to know what it is that you're looking for, and you have to already understand it in order to even know what you're looking at. Does that seem like a fair assessment? I mean, that's my experience anyways.
Yeah, I think, this idea that the labels are providing all the information that you need is, as you're pointing out, just not true, right? You can't even get a list of all of the ingredients that are on the label. They're just declaring the active ingredient. And then there's this whole formulation of who knows what in this product, and you really don't know what you're being exposed to. And from a toxicological perspective, this is incredibly concerning, right? And this is the way the EPA review process for these pesticides is structured, is that they only have to review the toxicity of the declared active ingredient. So whatever the company is saying is the active ingredient for killing whatever thing this product is supposed to kill, right? Because that's what these all are. They're sides, they're
It's a poison. I
targeting.
mean,
Yeah, they're
it's literally what
poisons.
it is. It's poison,
Yeah.
right? Yeah.
It's
Okay.
for different types of plants, different types of insects, rodents, roaches, whatever you have, bacteria. They're killing something, a living organism, and then they're declaring just one of the chemicals that's in this mix. Well, why are all of those other chemicals there, right? Are they not doing anything? It doesn't really make sense that you would need all of those chemicals if they weren't doing something or, in some way informing the impact of this solution on whatever it is that it's targeting. And so that's incredibly concerning, right? Because you're just looking at part of the formulation. And in toxicology, it's so incredibly important to look at the whole formulation because it's not just one chemical, it's an array of chemicals, and each of those can have their own impact on a living system. Even if they're not designed to kill that system, it doesn't mean that they won't impact it or impact somebody's health or their, endocrine system. But on top of that, the way these chemicals interact in these formulations can be synergistic. Some of the chemicals can help drive the active ingredient more deeply into the cell, where it can damage different things depending how deeply it penetrates the cell. They can also change the pH of these solutions, which can change the toxicity. There's so many things that can be altered by the combination of exactly what's in that formulation that even if you had the list of all the ingredients listed, you still might not be able to say how toxic it is just from that list. You would need to do experiments with that exact formulation to measure its impact on cells, on people, on fertility, on a baby that's developing. And all of those things need to be measured separately. And so the testing that we're looking at is incredibly inadequate. And the labeling is clearly inadequate because it's just not informing people. It's not giving them informed consent.
Correct me if I'm wrong here, but isn't it the EPA's job to do these studies? I mean, whose job is it to do the studies and then like let the rest of us know what's in these products?
It's actually not the EPA's job to do those studies, right? So under FIFRA, companies submit their own data to the EPA. And under FIFRA, companies are only required to report about the declared active ingredient of their product. They should be doing more studies and they should be doing those studies on the full product formulations. But right now, the way the law is written, they're not actually required to do that.
So is
But
this by states? I mean, if you had to guess, would you say is this by states like California and Maine and Maryland have stepped up and have, given different guidance from the EPA or like tried to maybe fill that hole a little bit by warning people of what's in these products? Like, are the states trying to sort of fill in where the federal government is, failing.
I think in some cases that is what we're seeing, right? That they're recognizing that and it's not just because of the full product formulation gap, it's also because the information a lot of times that the companies submit about their own active ingredients is actually highly inaccurate. And so even the information relating to just one of the ingredients is usually not correct in terms of what ends up on the label. And so I think we are seeing sometimes the states just stepping up and saying, well, there's a lot of scientific literature that says this is actually a carcinogen, and the EPA hasn't acknowledged that. Or there's a lot of scientific literature saying that this toxin can impact fertility and reproductive health. And the EPA isn't acknowledging that, and it's not on the label of this product. And so there is this sort of urgency, and that's very real, to provide additional warning to people.
I mean, it's the same thing, not to get too far off topic, but it's the same thing that's happening between the state and federal government when it comes to the labeling and public disclosure of lab cultured meat. FSIS has yet to return a decision about how lab cultured, lab cultivated meat will appear in the grocery store. And so the states have had to step up. South Dakota, for example, just passed new legislation that requires companies to disclose that it's lab cultivated, lab cultured, because there's not currently a federal regulation. The federal government has essentially failed in doing, what it's supposed to do, its job. So I kind of see these as very similar scenarios where the states are having to step up, where the federal government is either not acting, isn't wanting to act, being prevented from acting, for whatever reason is not delivering, right?
Yeah. And, I think even with lab cultured meat, I don't really know about all the regulations around that or what's in place, but I'm imagining that there's not a lot of toxicological testing on it. Do you know if that's happened?
Well, no, I I honestly don't know. What I do know is that the FDA gave these companies what's called a no questions asked approval, which means so long as the divided regulatory authority between the FDA and the USDA doesn't somehow find, which the USDA is not even set up to monitor human health effects. So I'm not even sure how this is supposed to happen. But
Mm.
apparently, so long as people are not, um, it- you know, calling in saying, "Hey, I ended up with food poisoning from this product," then the company is allowed to continue selling it. Something
Wow.
along those lines. So it,
That
it effectively puts the onus on the public to prove that they have been harmed by this product before the FDA will act. That's what it
And
means.
that's so concerning. I think about lab cultured meat and I think about what it's like to actually grow cells in a lab setting because I've done that a lot. And I know what the process is that's involved. And, I'm not sure exactly, I don't really know exactly what's happening with lab grown meat, but I'm guessing that at some point it's in contact with a lot of plastic because you need a substrate usually to grow cells and to grow tissues. And so, that's really one big difference between meat from an animal and meat that's grown in a lab is probably the amount of plastic chemicals that have entered into the meat or impacted its development. I can imagine that there are some interesting endocrine disrupting impacts of lab grown meat that have not even been looked at yet.
I bet. And, now we're seeing, instances where the FDA and the EPA is being pushed back. Like, for example, and I know that you haven't looked into this too much, but Section 507, it's another rider that's attached to this appropriations bill. And Congress is effectively pulling the funding after the EPA did do a health risk assessment. And that health risk assessment was on toxic sludge. And just like you're talking about, plastics and forever chemicals that have been sprayed on our farms, our food, and our playgrounds where our kids play. So the EPA knows that this is a problem. Congress commissions the report. They used our tax dollars to gather all this research, burn through millions, researching it, compiling all the information. And the evidence came back and it was so damning that Congress is now saying, bury it, bury it, bury it. We don't want that evidence on the record. But it just goes back to show if Congress can just, simply pull funding for any of these health assessment studies anyways,
Hmm.
it really makes you wonder, like, God, what is the point of an environmental protection agency that's not protecting our environment and not protecting American citizens? What are the what's the point of the anyways, I won't get into all that, but it just makes you kind of wonder, like,
Yeah. It's
goodness gracious.
It's incredibly concerning, that they're removing this type of funding that essentially is empowering the EPA to actually do its job, right? And the EPA is clearly not doing a very good job, but we don't need to remove more funding and remove more of its capacity to regulate these chemicals and to report, as you said, about important findings on toxins that are impacting every American at this point, right? These are exposures that are happening across the country, and they're impacting children while they're developing, they're impacting pregnant women while they're pregnant. We can't just ignore that this is happening. That these are essentially unprecedented levels of population-wide exposures,
Right.
and they have to be addressed and they have to be acknowledged. We're at a critical time where we simply can't ignore this anymore, and we can't allow, different aspects of the way the government is implementing their authority and regulations to avoid notifying people of the toxins that they're exposed to and to avoid, regulating what's appropriate. I think it's just so important right now that we really press back on this issue and say, you know what, it's enough. It's enough with these toxins everywhere. We've really got to empower the EPA to do a better job, and that starts by not cutting funding for things that it needs to do, because
Well, and
section
yeah, I
section
was just gonna get into section 453, right? Because it's not just that they're cutting funding. It's not like they're just like, oh, we're just gonna do a budget cut. It is very specific. They're saying
Mhm.
we are not going to allow you to use funds to act on this very specific risk assessment tool, or you are not allowed to use funds in section 453 to, and maybe you can help explain section 453 a little bit more.
Yeah, so Section 453 has incredibly broad language, right? That's the first thing to note about it, is that it's any act, any regulatory action. And so it's also not necessarily just applying to the EPA in that language, but let's just stay focused on the EPA. They're they're essentially, they're also, it's any type of action that conflicts with the EPA's human health assessment and carcinogenicity classification for a given toxin. And in theory, that sounds like, okay, it can't be that bad. But when you know that all of the data for those assessments has been submitted by the companies that are known to falsify their data, that submit incomplete studies of their data, that are just looking at one ingredient, then it's actually pretty irrelevant that that's what they're conditioning it on, because it's definitely not going to cover all of the information to keep people safe. So they're
Right.
blocking funding for, all kinds of things in that way.
Well, and then fast forward, like section 45 or 507, excuse me. This is exactly why people should be concerned about section 453, because if they're saying that you cannot issue new labeling, you can't even issue a warning on these labels unless that warning is consistent with the human health assessment study. And then here we are with section 507, where the EPA did the human health risk assessment study. Now Congress is saying, no, 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 no. You can't use any funds to act on that human health assessment study. What is to make the average person stop to think, like, oh, well, the next time they just do a human health assessment study on paraquat or gly- glyphosate or dicamba or whatever it might be, Congress isn't just going to step in and say, oh, guess what? Now you can't do anything with that risk assessment study. I mean,
Yeah, it's
honestly,
just,
the two together are, in my opinion, the perfect example of everything that is wrong with our federal government and why states must be protected. States' rights must be protected. Just my personal thought.
yeah, I think, the idea that, because it's blocking funding for types of actions, right, that can essentially contain new scientific information. And when you think about that, it's freezing all of these labels in place with old information, and it's freezing the warnings in place. So it's basically saying that as new science emerges, you can't in real time update the labels through this misbranding provision of FIFRA. You can't request a label update because it's going to have information that conflicts with what the EPA currently thinks. And it's locking science, old science in place, and it's really putting people at risk for all kinds of harm when you're doing something like that. And yeah, I think it's hugely problematic.
Indeed, it is. I would definitely agree with that. And in the meantime, we have aging farmers across the nation who are being increasingly diagnosed with Parkinson's disease. They're shaking to the point where they're no longer working their land. We don't have a younger generation that is taking over for them, and our farmlands are being consolidated. The farmlands that are workable and arable are being poisoned and permanently shut down due to government contaminations, and our own government is not cleaning up its own mess. I would say that this is probably the combination of both of these are riders, right? Um, Really, in my mind, are the epitome of what American farmers and ranchers are facing at the hands of their own government right now. And it's incredibly disheartening. It's not America first, and it is absolutely antithetical to the MAGA agenda. And I am, hat in hand, I am praying to God that the Trump administration sees this for what it is and intervenes before this passes on the House and Senate floor. Yeah.
Yeah, it's definitely not prioritizing Americans or American health. And it's, oftentimes shielding foreign corporations. And I think that aspect of it is so important to see, right? China is involved in a lot of these chemicals and a lot of these practices that are destroying the land here and exposing Americans to chemicals that are banned in China but sold here.
Isn't that crazy?
How can we even consider giving this industry a liability shield when that is a huge part of what's happening? It's not America first, and it's
No.
certainly not going to protect fertility or farms. It really isn't.
Yeah. Um, Thank you so much for your time, Alexandra. I really appreciate you, and I really appreciate your fight and for sticking up for our farmers and ranchers. From our family to yours, and from my kitchen table to yours. Thank you, ma'am.
Oh, thank you so much. I
God
appreciate all the
bless you.
work you've been doing on this. Thank you.
Yes, you too. And God bless. Take care.
Stop Section 453. Section 453 is a 9-line rider in the FY 2026 Interior Bill. It blocks EPA label updates, freezes outdated science in place, and gives chemical companies immunity from lawsuits. If it passes, 57,000 pesticide and chemical products will be shielded from accountability. Call your representative and say, "Please remove Section 453. It strips Americans of due process, defunds critical label updates under FIFRA, and protects foreign chemical corporations instead of public health."